Hey, it's 640 News Radio 1029 KRN. Dr. Steppe Mette with UAMS. Good morning. How are you doing?
Good morning, Kevin. I'm well. How about yourself?
Doing fine. And that's the thing that we're curious about here. There's been a lot of concern and a lot of warning about gatherings over the holidays. What is the big issue with COVID and the holidays? Where does this all come together?
Yeah, it's just a basic logical thing that if you have a lot of people coming together who have not been living together, people from different parts of the country, family and friends from different neighborhoods, states, different parts of the country coming together and not knowing whether they are infected, obviously can infect a bunch of other people. So we all like to get together over the holidays, but this year it could be hazardous to do so.
Well, and a lot of holiday gatherings, too. I mean, it wasn't just for Thanksgiving. That's when people get together, but also, too, some people are still planning to do Christmas parties. They're trying to do family gatherings. A lot of churches still meeting and doing their things, too. If that is something that's happening and something you plan, is there a way to be safe if you are involved in one of those events?
Well, the safest thing is, of course, what has been discussed all along, and that is wear a mask at all times, keep your physical distance greater than 6 feet, wash your hands, and keep two gatherings as small as possible. Understanding that the larger the gathering, especially if indoors, the more densely packed the room is, the more likely it is that there'll be transmission of the virus. So try to be smart.
Maybe you can address some of the things that are out there. I mean, there are a lot of armchair quarterbacks that talk about COVID-19. They come up with their own theories on this. One of those, and see if you can hit this, we're all going to get it. Are we all going to get it? Is that true or false?
There's no reason why that has to be the case. And I think the vaccines are looking very promising indeed. And if we can all get inoculated, all get vaccinated, there is no reason why all of us have to get the virus.
It's just like the flu.
Wrong.
Explain how.
Well, people get much sicker with COVID-19, and the mortality rate is much higher, 10 to 20 times higher than mortality from the flu. So it is not the same. It's not the same virus. Many more people end up in the ICU, on ventilators for a long period of time. And it's true that there are individuals that hardly have any symptoms at all. There are those that have mild symptoms, but it is not the flu, and nobody should be making that comparison.
Dr. Steppe Mette with UAMS, what about this one, too? It's okay. We're all going to have herd immunity.
Well, it's an interesting question. Herd immunity does seem to work for many viruses, including influenza. It's not yet clear about whether this actually works for COVID, and thus far, some indications are that it may not. But if we are going to have herd immunity, the most rapid way to get there is through vaccination, and that means a large percentage of the population will need to be vaccinated.
What does it even mean, herd immunity?
It means that there is a large enough percentage of the population, people that we all live with, who have had the virus or been vaccinated, have antibodies, are immune, and so that the virus cannot spread easily from one person to another. So sometimes for some viruses, you just need 70% of the population to be immune. Others might need a higher number. So it's conferring immunity of a large population to those that have not been infected because the virus can't spread.
One of the things I hear out there, Dr. Mette, is that this is an old person's concern. It's a bigger issue if you have underlying health issues or if you're older, which seems to be the case in I guess, some of this. But what about young people, people that are healthy adults? Are they should they be as concerned about this too?
It's true that healthy younger people have a lower chance of getting significantly ill, but there are plenty of healthy young adults who have gotten sick and have died. It is estimated, Kevin, that about 100 million Americans, so 1/3 of the population, are at risk because they're of extreme age or have comorbid conditions. So it's nothing to be trifled at.
Kevin Miller talking with Dr. Steppe Mette with UAMS. What about the whole idea of overwhelming the hospitals? We keep seeing the cases increase in the state day to day. The numbers are not where anybody wants them to be, but also seeing more hospitalizations. What is the status of that now?
Yeah, I mean, Arkansas hospitals are full. Last week we were at about 95% occupied. Our ICUs are getting there. And as the number of cases, which have doubled over the last several weeks, continue to increase, we do run the risk of overwhelming our hospitals. Thus far, we haven't seen what is happening in El Paso or happened in New York earlier in the spring, but there is that concern, and that's why all of us in healthcare are being so vocal about taking care and making sure that we protect our precious resources.
Let's touch on this, too, the vaccine. Any worries about getting that? There's new technology involved with this.
Thus far, from the data that has been made public, the vaccines appear to be safe. I do think that the public deserves to see all the data to make sure that we know what we're getting. But I don't think that the Food and Drug Administration will approve any vaccine that is not safe. So thus far, no concerns, but of course, nothing is without risk. The risk of getting sick, very sick, and dying from COVID-19 almost certainly far outweighs any risk from a vaccine.
Right. What about this new technology that's been used in this? This is something that it's not a live or a dead virus. This is something that it actually blocks the receptors. And is there other things we might see used for in the future?
Yeah, it's great novel technology because of its technique. One can create vaccines much quicker, as we were seeing with this technology, the messenger mRNA. There is so far no concern about the safety beyond the traditional means of creating these vaccines. It still creates an immune response. So the covering the receptors is part of immunity anyway. So it is a classic immune response, just using a different technology.
It's very interesting stuff. I'd read your bio, but it reads like a novel. And so just suffice to say, he's the Senior Vice Chancellor for UAMS Health and the Chief Executive Officer for UAMS Medical Center. Dr. Steppe Mette, good to have you on this morning. Thanks so much.
Good to have you too. You take care.
All right.